Live from KTV in Reno, you're watching 2 News at 6:30.
I know that we can't do everything at one time financially, but we're going to do the best we can and start making inroads.
We are talking to Steve Sisolak, who's running for governor, about his plans for health care if elected, as well as the plan of Adam Laxalt. Campaign 2018 tops 2 News at 6:30. Sisolak says he supports Medicaid expansion and the Affordable Care Act. I'm Kristen Remington.
And I'm Landon Miller. Thank you for keeping it here. His Republican opponent, Adam Laxalt, released his health care plan just last week. Paul Nelson shows us where the candidates stand.
Sisolak and Laxalt both spent the day focusing on health care. Laxalt attended a health care event in Las Vegas, and Sisolak toured a clinic here in Reno. Both say they want to strengthen the same things, but how they plan to do it is much different.
Your real pleasure. How do you do?
Steve Sisolak toured this Community Health Alliance clinic today, saying health care is one of his top priorities.
You know, we need to make sure that folks don't have to choose between buying groceries and paying for a prescription. I think we've come up with a plan that we can make progress.
The Kaiser Family Foundation estimates 1/4 of adults under 65 in Nevada have pre-existing conditions. Sisolak says they should be protected.
Diabetes is a pre-existing condition. High blood pressure is a pre-existing condition. Those are things that if you're branded with that and it makes it difficult for you to get health insurance, that's a real problem.
Sisolak supports Medicaid expansion, but says our state doesn't have the resources for a Medicaid for All program. He says more transparency with pharmaceutical companies and creating a buying co-op to get medications in bulk could drive down costs, and says Medicaid reimbursements need to be higher.
The reimbursement rates right now are not paying the costs. If we want to keep the doctors, right now we're already short of doctors. If we continue to reduce these reimbursement rates, we're going to lose more doctors.
Adam Laxalt says Nevada can attract new doctors with a loan forgiveness program, investments in residencies, and reductions in regulations. He wants to attract more mental health and addiction professionals with looser licensing requirements, and says direct enrollment to Medicaid will prevent ER visits. And he says he can strengthen Medicaid with reimbursement reform by adopting work requirements and eliminating waste and abuse. In a statement, Laxalt said in part, quote, "We need to strengthen Medicare, protect people with pre-existing conditions, address the shortage of doctors and nurses, and confront our mental health and addiction crises head on." We did try to talk to Laxalt about health care today, but he wasn't available. If you want to check out the candidates' health care plans, head to our 2 News app or website. Covering Campaign 2018, Paul Nelson, 2 News.